A valvuloplasty, also known as balloon valvuloplasty or balloon valvotomy, is a procedure to repair a heart valve that has a narrowed opening. Valvuloplasty, tricuspid valve, without ring insertion. With ring insertion. Cardiopulmonary bypass is initiated with venous uptake tubes in both of the caval veins. The right atrium is opened. Valvuloplasty of the tricuspid valve almost always requires nothing more than reducing the diameter of the tricuspid valve. A double purse string of sutures is placed around the circumference of the valve and tightened to reduce the valve diameter. The right atrium is closed. Report 33,464 if a stiff ring is used to reduce the valve's diameter rather than purse strings. Valvuloplasty, mitral valve, with cardiopulmonary bypass. With prosthetic ring. Radical reconstruction, with or without ring. This operation is done to improve the ability of the mitral valve to close completely when the ventricle contracts. It is done in patients whose mitral valve has lost the ability to close normally. In almost all cases, this is the result of a mitral valve prolapse in which the mitral leaflets and the cords that tether them on the ventricle have become elongated. Cardiopulmonary bypass is initiated. The left atrium is opened and the mitral valve is exposed. Redundant leaflet tissue is excised and defects in the valve leaflets are closed with sutures. The cords are also shortened with sutures. Valve closure is assessed after the repair. The left atrium is closed and cardiopulmonary bypass is discontinued when heart function returns. Report 33,426 if the mitral valve diameter is enlarged requiring placement of a prosthetic ring. Report 33,427 if a more extensive repair, including transfer of cords from the posterior leaflet to the anterior leaflet, is performed. A prosthetic ring may be required with extensive reconstruction. Valvuloplasty, femoral vein. The physician makes an incision in the skin overlying the site of the incompetent valve. The femoral vein is isolated and dissected from adjacent critical structures. The physician affixes vessel clamps above and below the malfunctioning valve. The physician opens the vein and repairs the valve leaflets by suture plication, tacking the excess valve material. The vein is repaired with sutures. The clamps are removed and the skin incision is repaired with a layered closure. Total lung lavage, unilateral. The physician performs total lavage on one lung. The physician views the airway using a fiber optic or rigid bronchoscopy. The airway is anesthetized and the bronchoscope is introduced through the nasal or oral cavity and advanced to the lungs. Saline is introduced through the bronchoscope and the lung tissue is washed or bathed. The saline is removed by suction. Ablation therapy for reduction or eradication of one or more pulmonary tumors, including pleura or chest wall when involved by tumor extension, percutaneous, radiofrequency, unilateral. In a minimally invasive procedure, the physician uses the heat created from high-frequency radio waves to destroy one or more tumors in the lung, pleura, or chest wall. A small incision is made in the skin of the chest and the lesion is accessed by inserting between the ribs an ablation probe connected to a radiofrequency generator. Under CT guidance that is reported separately, the ablation probe is advanced into the lesion of the lung, pleura, or chest wall. Treatment with the heat probe usually takes several minutes and may include repositioning the probe within the lesion so that overlapping ablations treat the entire tumor. The incision is closed with sutures. This process may be repeated for multiple lesions within the same lung. Aortoplasty, gusset, for supravalvular stenosis. Cardiopulmonary bypass is required. A piece of pericardium or dacron is prepared. The aorta is clamped beyond the area of narrowing. The heart is stopped with a cold-preserving solution. The aorta is opened longitudinally across the area of narrowing. The aorta is closed with a patch sewn onto the incision of the aorta. The clamp is released. Cardiopulmonary bypass is discontinued when heart function returns.